Hey, I'm Rebecca Gordon.
I'm Sylvia Gordon.
In this edition of the Weekly Wednesday Wrap-Up, we're going to find out, will Medicare cover dental, vision, and hearing in 2022? Things are changing. I hope you're still with me, and that was a good enough teaser. So Bernie Sanders, he's back. He's proposing some new legislation.
They're printing money like crazy, and they're giving it out to kids and to renters, and they're giving it out to COVID. Money's coming. We're all going to pay the price in higher Part B premiums. We're going to pay the price in higher Med Sup. We're going to pay the price. It's all coming. But
they want to try to get dental, vision, hearing covered by Medicare. Now, if they act quickly before the midterm elections, they have the power in the House to pass this.
it's very likely that they can get some of these. They have a lot of healthcare legislation on the table. Some of it has bipartisan support. I get a lot of people that are asking me about the Social Security Fairness Act. And it has, again, bipartisan support. So it's likely to get passed. The thing is, we've been on the cusp of getting COBRA fixed and getting things fixed for years. It took 8 years to get OEP back.
Right.
8 years. So we'll get right to the finish line, and then like Osama bin Laden will die.
Right.
Or, I don't know, Colonial Pipeline gets hacked and there's no whatever. So something can happen, and then boom, nobody cares about these things. They get yanked. But I think it's likely that we will get dental, vision, and hearing. I think it's likely that the Social Security Fairness Act will pass. If you don't know what that is, ask in the comments. We'll explain it to you.
Well, and I think a lot of customers would like to have dental, vision, and hearing covered.
Right. Or at least to have dental, to have some basic dental, because it's so expensive. So good things are happening, but it will inflate the prices. All of this comes back.
We'll pay for it.
Expect a huge Part B increase for January. Of course, it won't come out until the end of the year. Expect big rate increases on Med Sups, which is why I'm not a fan of the G. It's not my go-to plan. I'm a fan of
N.
And most agents still don't sell N.
So I think, the number one reason, I'm curious why you're not selling N. You can put that in the comments. But when I look at the Med Sup grid of what covers what, there's one hole, excess.
And most agents, they're just like, they're just scared of excess. They don't really understand excess, and they've never done the math on excess. I've sold primarily Plan N for years, and they used to cut commissions on N.
Which is interesting.
Which sucked. But now, some of them, I'm not going to mention one of them, just raised commission like 4 points on N. They want you to sell N now.
So the go-to was G, and everybody pushing G, and now this new, healthier, maybe more profitable block is N.
So people are still nervous. Okay, now that they're going to pay you more, that's cool. The rate increases we're seeing on F and G, well, let's just say G, they're like 10%. Rate increases on N right now are like 2 to 4%. So that should get your attention right there. But we all come back to excess.
Yeah, so the thing that so many of us forget on excess, it's not you're paying all of this charge. There is a safety net of up to 15%.
So if you're going to get rotator cuff surgery, and Medicare is going to pay $1,000 for it, and that's not like crazy. The Medicare approved costs are very low. Shockingly, you would never believe it low, which is why doctors don't like Medicare patients. Okay, so it's $1,000, and I have a Plan N.
Then it looks like I'm 100% paying all of that excess fee. Am I paying $1,000?
Nope, you're only going to pay 15% above Medicare. So you pay $150.
That's it.
$150. You're saving money every month on an N over a G. You've got to look at N, people. N is going to be the go-to plan for people that can, coming off the group,
they're going to have to qualify
They're
for
going to
it.
have to qualify.
Through underwriting.
Which will mean there'll be a bunch of healthy people there, which is what we all want. That keeps the rates low. If you live in certain states, excess is illegal. So why are you not selling in if you live in these states?
And these states are Connecticut, Massachusetts, Minnesota, New York, Ohio, Pennsylvania, Rhode Island, and Vermont. Wake up, folks.
Wake up. If you live in those states, you should be selling in. Now, not every carrier files an in, but some of the big ones do. They file it everywhere, and some of the big ones did raise their commissions.
Just
on
hop on our quota. Our quota is free. If you don't have a login to that, just let us know. It's open, and you can just see what there is in that state.
Right, go look at it.
Done.
Okay, let's talk about our AEP kickoff events.
AEP is our favorite time of year. Everybody works so hard, and we get ready to put on a big show for our Central Indiana part of the United States agents. And this year it's on August the 20th in Carmel. But here's our list for other states. We love to get out on the road. Florida.
3 cities in Florida.
Texas. New York.
Washington. Idaho. 3 cities. Long Island, New York.
Long Island.
I think we might have Delaware. Delaware too. But save the dates. Stop your screen and see the dates, or it's on Gord Marketing's website. If you go to gordmarketing.com, go to events, you can see the dates and you can register.
What is save the screen? What does that mean?
You can stop your screen right now so that they can screenshot it and save the dates.
I've never heard that.
Okay.
I think she made that up. All right, so this was funny. I was talking to Dad the other day, and he was complaining about getting these constant calls from United Healthcare, who he's a member of. And he's like, good God, they're constantly calling me when I'm during my naps. I'm trying to watch my Westerns.
First of all, do your parents take a nap but leave their cell phone on? Then answer when you call during a nap, and then yell at you for waking them up from a nap. I'm like, turn your cell phone off.
We've been telling him that for years. He won't do it.
Right.
He says if I turn off my phone, I'll miss something.
Yeah. Right. We'll call you back after your nap.
Then don't take a nap.
Yeah. You're 86. You need a freaking nap. I'm 56. I need a nap. I turn my phone off. Let's go back.
So
he complains about it, and most agents that sell Med Advantage, we've had a lot of complaints. They're like, they harass me. They hound me. They call me all the time. It's nonstop. Make it stop.
Yeah. The point of the matter is this. When the carriers reach out and engage the clients are happier. They tend to utilize the services, which in turn will keep them healthier. It's a good thing. We have the data to prove it.
The scores go up, the stars go up, the money flows, the benefits are better.
Everything is good.
It's a cycle. HealthPayer Intelligent reports that Medicare Advantage members' satisfaction levels actually increased in 2021, but member engagement remained low. And they know when member engagement is higher, that people, they stay, the persistency is higher.
Everything is better.
And the scores go up, the star ratings, and the money flows. So, as an agent, my clients complain to me. They're like, can you put me on a list so they stop calling me? No. They're going to call you. Why?
And we want them to call you.
They want to keep you healthy.
They want to keep you healthy. Get your flu shots.
They want you. They're like, hey.
Have you been vaccinated?
You didn't get your mammogram. Hey.
Do this. Do that.
They're going to nag you. And sometimes that's important because we're not nagging ourselves to get it done.
I love it. Sometimes I have to hear things, shocker, like 3 times. 3 to 5, they say that for a new habit to occur, you need to have it, you need to see it or hear it like 3 to 5 times to get something moving. So yeah, they're gonna keep calling.
Send Sylvia chocolate. If you appreciate these videos and you have learned a lot over the years, please send me chocolate, please.
Dark chocolate.
Dark chocolate.
Oh, you gotta
my
say
favorite. Has cinnamon, my favorite has hot peppers, dark, has to be dark. Very dark.
She likes dark chocolate.
So we're doing a lot of work here for you guys for free. Please, somebody send me some swag. Somebody send me something. Okay.
Or ice cream. She does like ice cream.
Going back to these preventative services, the colonoscopies. Now you can use Color Guard instead of a colonoscopy. You guys got to get that out there. And I have a sample. Somebody got one and they're not going to take it, so I have a sample. I'll be able to show to my clients and kind of say, hey, it's good. It's fine. It's approved.
How much of a sample are you doing? Is this like going to be a revisit with
like
the goats?
I'll bring it in.
We're on.
It's just a little packet like this. It's just like a little envelope that comes in the mail. Your doctor has to prescribe it.
All right.
But a lot of people, if they know they didn't have to go to that invasive procedure,
drink the Kool-Aid, so to say,
then they would get their colonoscopy. Yeah. So these carriers are going to call and nag you and say, hey, get your colonoscopy. Colon cancer is like the third.
It's preventable.
Right, and it's like the third highest cancer. And you can now just do it in your, do a little, in your home. So they're going to keep nagging you, and they're going to probably keep complaining to the agents like you, like they complained to me. And you just explain to them, hey.
This is a good thing.
They're trying. If they, I've had a lot of nurses that complain. They're like, I don't need somebody to remind me. I get my own stuff done. And I get that. But we all have caller ID. You don't have to answer.
No doubt.
Right? But for the majority of people that don't get it done, we do need that. And it does drive star ratings.
I'm glad they call. My parents, keep it up. Keep them healthy.
So You guys, I hope we see you at one of the AEP events near you. If you want to fly into our main event here in Indiana, talk to your marketer,
We'd love to have you.
and hopefully we will see you soon.
Good selling, folks.